It's not giving what it's supposed to give. It's not giving what it's supposed to give. It's not giving what it's supposed to give. Hello, welcome back to my channel. My name is Jasmine and this is Jazz Live. Today I'm going to be talking about RN salary and why there is this idea that nurses make a lot of money. I know that these days, the talk about travel nursing and travel nurses making upwards of $100 an hour has been going on. But there's also this idea that nurses are really leaving the bedside. So as a new grad RN, I'm going to be deciphering through how much I make an hour, the offer, the differentials, and the different reasons why nurse salary may differ. Are we really balling like that? Like, what's the tea? First of all, I want to talk about the whole culture with Gen Z, where we are leaving jobs, we are pursuing careers that's going to give us more money, more flexibility, and we are really valuing our own time. However, when it comes to nurses requiring an increase in salary, there is a negative connotation when, they talk about nurses who are striking and how it's seen as neglect. So when you compare the salary that nurses make to the amount of work and effort that they put in, it's not comparable. As nurses, we have been bartenders in concocting medications and foods that patients want to eat. We've been friends, advocates, caregivers, educators, counselors, motivators, and so much more. So the factors that affect nurse pay are location, specialty, shift differentials, nursing degree or education, and experience. So first of all, when we talk about location, we know that different states offer different wages. For example, in California, nurses make upwards of $55 to $60 an hour, depending on the area that they are in. And we know that the location also influences the cost of living in that area. So in California, where the cost of living is higher, nurses are going to be making higher income. But does this necessarily mean that they are making a lot of money? So in California, nurses may make up to and above $100,000 a year. Whereas when you transfer that to Massachusetts, the range is going to differ from $45,000 a year to $90,000 a year, depending on the length of experience and again, the specialty that they are in. Going into specialty, nurses can work in a variety of different environments. There are school nurses, there are psychiatric nurses, there are med-surg, ICU, emergency room, laser, aesthetic nurses. There's a really long list of the different specialties and areas that nurses can work. So if you compare, for example, a school nurse to an ICU nurse, we know that the ICU nurse is going to be making more money because their job requires a certain level of skill and experience in order to take care of their patients. Another factor that can influence nurse pay is shift differentials. So there are many different shifts that nurses work. Traditionally, there's 9 to 5 shifts that may happen in a school, or there is a 7 to 3, 3 to 11, 11 to 7 shifts that happen in the hospital. And in the hospital, there's also like the 12-hour shifts, which is 7 a.m. till 7 p.m. or 7 p.m. till 7 a.m. So we know that nurses that work during the day may make a couple dollars less than nurses who are working at night, because nurses who work at night are sacrificing a part of their lives, a part of being with their families to come and take care of those patients. When I started off during my residency, I was working day shift, but now I'm working the night shift. So the night differentials. Another factor that can affect nurse salary is education. And so there are bachelor prepared nurses, and then there's also associate nurses. These days, lots of hospitals, I know in the Boston area and even bigger hospitals that are maybe like a level 1 facility, may require nurses who have their associate's degree to then go and get a master's degree within 1 to 2 years of employment. I know that for my cohort, that was a requirement. However, because I'm a bachelor's prepared nurse, I don't have to do that. There are also nurses who may have a master's degree in nursing, and depending on whether, they were using their previous degree in their job, they may be entitled to being paid a slightly higher wage. Last but not the least, there's experience. So many new grad programs all over the United States, they are known to be paying significantly less than the average nurse income because you're taking time to train these new nurses and give them skills to become more confident in their jobs. And as such, they require training, preceptorship, mentorship in the hospital and in their various areas that they work. So the income is significantly less. So the average income of nurses who have less than 1 year of experience may be as low as $18 an hour to about $35 an hour or more, depending on, again, the location, the specialty, and the shift differential. Nurses who have 2 to 3 years of experience, now the income range is gonna be from about $30 an hour to $50 an hour, depending on, again, the location, the specialty, the shift differentials. And then nurses who have upwards of 6 to 10 years of experience will really be at the top of the food chain in that regard. So according to one of the census that I looked at, the nurse median salary in 2019 was $73,300. The best paid 25%, so the top 25% made upwards of $90,000, $760 a year, while the lower 25% made downwards of $60,000 a year. I'm going to pull up a pay stub. So the base pay that I was offered was $32.71 an hour. Given a 40-hour week, the evening differential is $36, which means that I'm making an additional, give or take, 4 and 4 plus 32 is 36. And then, so with the 9 differential, I'll be making an additional $120, which is $5 an hour, because 24 times 5 would be 120. So out of a 40-hour week, working the evening differential 12 hours and then the 9 differential 24 hours will give me a gross income of $1,464. Now, let's get into the taxes. So, federal tax, FICA, mass tax, medical, parking. I pay $6 parking a week, which is great because I know in some of the Boston hospitals, parking is up to $60 for a day. The net pay to take home would be $1,001.97. Will be $1,001.97. So, is it enough? Another important thing that I should mention is that at this facility, I get paid weekly. So, bi-weekly, the pay will double and it will be $2,000, about $2,000 for 2 weeks. And then for a month, that would be about $4,000. Is it enough? The average student loans in America in 2021 is $37,000. I graduated with about $25,000 in student loan debt. And so if you look at the time, the effort, the dedication, the struggle that it took to complete my nursing bachelor's, I don't really think it's enough income because the pay per month means that I will make $48,000 a year as a new grad. And I know that it's because, I'm in a residency program. I have little experience. Possibly also the location may contribute to the reason why I'm making significantly less than others. However, it's not enough. Also, another thing that I don't like about nursing is that there's a pay cap. And that's not really something that I want to have, because I want to always be exponentially increasing my wealth. And so because there's a pay cap, when it gets to a certain point, after maybe I've earned about 6 to 7 years of experience, the amount of money I'm going to be making per hour is going to plateau. So unless I decide to go back to school and get a more advanced nursing degree, or choose to pursue something in addition to nursing, it's not looking great. It's not looking great. And I believe that nurses should be paid more because of the work we do. It's a lot of work. It's not giving what it's supposed to give. It's not giving what it's supposed to give. It's not giving what it's supposed to give.